All right, guys, we're going to give everybody a few minutes so they can sign on and I can take attendance. All right, guys, can you all hear me? All right, cool. First of all, thank you for dealing with my switcheroo. I had some family stuff come up, so I had to make sure that I was available today. So thank you very much for working with me. I'm sure you guys all don't mind that you didn't have to go into class, but just as a reminder, because we are lecturing today, we will be in class in lab on Wednesday. Okay, so I will remind you guys of all of that at the end of this lecture today. Lecture is pretty straightforward today. You guys should know most of this, so we're gonna try to get through it pretty quickly. It seems like a long slide. It says there's 57 slides, but it goes super, super fast. It's not like we're spending tons of time on the actual slides themselves. Because we will not be doing a lab on this chapter until next week, on Monday, I believe, we will go over this a little bit again very quickly just so you guys can refresh your memory so I'm not just throwing stuff at you. Just like on Wednesday, we will also be going over some stuff before we get into lecture. If you guys have not looked at those videos that I put up, I see that everybody has turned in their assignment, so good job on that. Make sure you guys familiarize yourselves with that because with how things are in class with COVID and everything, it might be a little bit more difficult to do what we're gonna do on Wednesday, so just make sure you guys are watching the video as well. Okay, any questions before we jump right in? All right. So today we are going to be going over blood pressure, okay? You guys all should know what blood pressure is, okay? It's one of the most basic measures of physiology that provides information for the total work of the heart, okay? So your blood pressure is basically telling anybody who is taking your blood pressure how your blood or how your heart is pumping. Is it pumping healthy? Is it efficient? Is your blood pressure too high, too low? All of those things. It's so important that every time you guys go to the doctor, regardless of what that doctor appointment is, they're taking your blood pressure, okay? So I know every single one of you has had your blood pressure before, okay? So basically the definition of blood pressure is the pressure that is exerted against those arterial walls, okay? So those arteries as the blood is pumping out of the heart, okay? So during systole, okay, which is the top number on blood pressure, okay, it's your ventricular contraction, okay? So remember that left ventricle is pumping blood out. That is going to be systole. That's going to be the top number on your blood pressure, okay? It's always going to be the higher number, okay? Dystole or diastole, however you guys want to pronounce it, is basically ventricular relaxation, okay? So when it's blood is pumping back into the ventricle and filling up before it is obviously pushed out again. Okay, any questions on what systolic and diastolic are? No? Okay, cool. All right, so blood pressure depends on the volume of blood that is delivered. Okay, so what we talked about, just like we talked about in the last slide, it's that vascular resistance. It's the resistance that your blood vessels have to overcome in order to provide blood flow throughout your entire body. So that's basically what blood flow is, or I'm sorry, what blood pressure is, and it deals with the volume of actual blood that is pumped out every single time. Okay. All right, it can be determined by several things. So diameter of your blood vessels, okay? So we all know, we've heard of arteriosclerosis, things like that. That's hardening of the blood vessels and plaque buildup, okay? So that makes your blood vessels not they're not as elastic and blood flow can't go through them as much. So your diameter of your blood vessel, okay, the more narrow it gets, the harder that blood is to pump out, okay? So it can be narrowed by things like heart disease, like I just talked about, some other types of illness, and also things as regular as stress. We all deal with stress, but when we are stressed out, we have hormones released and our blood vessels can shrink in diameter, making it harder for us to pump out blood. Okay, it's determined by your heart rate. You guys should all know what your heart rate is. Obviously, it's the amount of beats per minute that your heart beats, okay? Your stroke volume, we've all gone over this before, I know again, but we'll review this a little bit. So your stroke volume is the amount of blood that is pumped out with each contraction. So every time your left ventricle pumps, that's your stroke volume. So with just one pump of your ventricle, okay? Your cardiac output, which is denoted as Q, okay, or sometimes it is denoted as CO. So if you guys see that, that also means cardiac output, is basically your heart rate times your stroke volume. So it is the amount of blood your heart pumps out in an entire minute. Okay, so stroke volume is that one beat, okay, out of the left ventricle, how much blood comes out with every beat, okay, and then stroke volume is the amount of blood that is pumped through your body in 1 minute, okay? So however many times your heart beats. All right, questions on that thus far? Nope. Okay, a lot of this stuff is gonna be pretty self-explanatory for you guys, okay? So changes in blood pressure can be either to vascular resistance, okay? So we talked about vascular resistance being if your blood vessels narrow, okay, and how much pressure actually has to be exerted, or a change in cardiac output, or both, okay? So obviously blood pressure changes if we're not pumping out as much blood, okay, from the heart in a minute, or it can also go higher if we're pumping out more blood and our heart is pumping a little bit more every minute, okay? So it can change through vascular resistance or cardiac output, or both of them, all right? So arterial systolic blood pressure. So you guys will see it denoted as SBP, okay? So that's systolic blood pressure, okay? This is the max pressure, okay, and push against your arteries, okay? So when your blood pumps out of your left ventricle, you know it's going into the arteries of your heart. So it's going out that ascending and descending aorta, okay? This is also caused from left ventricular contraction, like I talked about. So this is your systolic blood pressure, okay? So when you guys are thinking about this, this is happening with a contraction, okay? So there is going to be max pressure, all right? Your diastolic blood pressure is that lower number, okay? When the ventricles are filling back up, it is minimum pressure, okay? So that bottom number, if we have large variations in that bottom number, it's much worse than having those larger variations in that top number, okay? Because this is happening during ventricular relaxation. It's allowing the ventricle to fill up more with blood, okay? This is a better indicator of cardiac stress. So like I just talked about, this number should not change that often, and it'll only change by 10 to 20. Okay, even that amount of change, even if we're doing max exercises, things of that nature, is a better indicator to see if we really do have heart stress, because it really should not change. Our top number, because it's with pressure being exerted, that max pressure, it is going to change and deviate. That diastolic number should not deviate. If it does a lot, then we know that we have some sort of issue, okay? Blood pressure readings, you guys should know this. It's always systolic over diastolic. So pretty normal blood pressure would be that 120 over 80, okay? I don't know if any of you guys have ever gone to get your blood pressure done, but it should be somewhere around that. Standards for high blood pressure. Okay, so they were changed in November 2017. You guys don't have to remember November 2017, but to be hypertensive, which is called actual high blood pressure, okay, it's having that hypertensive disease, used to be 140/90, okay? The American Heart Association changed it. It is now 130/80. So anything above 130/80 is already into hypertension stage 1, okay? So it's a little bit different. Most times they want this number of 120/80 to be lower, okay? So this is basically your normal, but you're teetering on that pre-hypertensive stage if it goes above that, okay? Any questions on any of that? Nope. So this chart does just kind of show you what normal high, stage 1 hypertension, stage 2 hypertension, okay? This normal reading and even into the stage 1 hypertension doesn't necessarily mean that you're going to need medications. What it does, and one of the reasons why they changed it to lower that number, because it allows the individual with high blood pressure and a doctor or a clinician, whoever you are seeing, in order to try lifestyle changes before that they give you guys medication, okay? So this is why they lowered the number, because they always want to try to do lifestyle modifications first before putting you on medication, okay? Make sure you guys familiarize yourself with this chart, okay? So it is in your PowerPoint, because you guys are going to need this come exam time, and then also when you're going to be doing some homework and stuff in your lab. Okay, this is another one to kind of look through. It just talks about active men and women. Okay, so we have our age range here. Okay, so you can see very low blood pressure would be 140/70. If you have low blood pressure here, something along those lines, we know that there is obviously some form of indication that something is wrong. Okay, so your average, they say, is anywhere from 110 to 120/72 to 80. Okay, so this is your normal blood pressure. Once we get above that 180, or I'm sorry, above that 120/80 is when we're starting to get into the high. Okay, so just make sure you guys familiarize yourselves with this for women and also men, and see if there's any deviations in it. Men are obviously going to have a little bit higher blood pressure. Okay, so you guys should also remember that. Questions on any of these blood pressure readings thus far? Okay, cool. We're going to move along. Okay, so hypertension, obviously it's that high blood pressure, that sustained high blood pressure contributes as risk factors for coronary heart disease, okay? It may also be a contraindication to beginning or continuing exercise testing. Do not get this contraindication mixed up with what you guys did on your exam, which we will talk about when I hand out your exams. But it's just saying hypertension basically is a red flag, okay? It's a red flag for coronary artery disease, heart disease, okay? And it should also be a red flag if you are administering testing. If that hypertension is sustained and it is not under control, remember then it's going to need to be looked at, okay? And they're going to need to get someone to clear them before they exercise, okay? It is imperative that exercise professionals take accurate blood pressure measurements, and I will explain why, okay? You need to make sure that you are taking accurate blood pressure measurements, whether you are a doctor, you are a clinician that's administering tests or anything of that nature, because there are many things that your blood pressure can depend upon and reasons why it changes. Different body positions will cause you to have higher blood pressure, lower blood pressure, okay? But you need to know this, because if this individual does not know that they have hypertension, okay, and they're not on medication, you need to know, hey, is this person, do they just have high blood pressure right now because they're a little bit nervous to be at the doctor or getting a fitness assessment? Am I gonna let them sit for a minute, get their heart rate down, and then find their true blood pressure measurement, okay? So this is why we need to make sure that we have accurate readings. It's not always the easiest of things. Okay, so kind of like what I talked about, body position, we will talk about how that affects blood pressure in a little bit. Hydration affects blood pressure, okay? If you guys are dehydrated, sometimes your heart rate slows down, okay? So it's not pumping as much blood, it's not pumping as hard. Your blood pressure is going to go down, and you have a chance of actually passing out. And like I talked about, gender, men typically have higher blood pressure readings than women do, okay? So these are all things to consider. Okay, it can also depend on muscle activity. So when we're talking about muscle activity, we're basically talking about working out. Okay, so if you are doing a resistance training exercise and you are going towards maximal effort, your systolic blood pressure is going to get super, super high. It can get up to 250. Okay, however, it shouldn't be sustained there. but muscle activity is going to affect what you guys are doing and how what your blood pressure readings are, okay? You need to have your blood pressure go up and down, obviously, because when we are working out and we are using large muscle groups, we need that heart to pump that blood and pump that oxygen and everything to our working muscles, okay? Stress affects blood pressure, just like I told you, if you guys remember from your personal training classes, other classes. Stress is caused by a lot of things in our life, but we have a hormonal response to it. Okay, so sometimes that cortisol is released. If we have too much cortisol, it really raises our heart rate. Okay, so all these things can have your effect on blood pressure. Okay, diet has an effect. So think about if we're eating large amounts of fats, it could clog our arteries, causing it to be more difficult to pump out blood. Okay, also salt really raises your heart rate a lot of times. That also is going to affect your blood pressure, and tons of different diseases, whether it be liver disease, diabetes, all those types of things can have an effect on blood pressure. Okay, so this is why you guys really need to know the history of your clients and what is going on before we do fitness assessments. Okay, all right, so we're talking about body positions and how blood pressure differs. Okay, in your supine position, so that means you guys are just laying flat down. Okay, this is when you're probably going to have the lowest amount of blood pressure. The reason, or lowest blood pressure reading, I'm sorry. The reason for this is your body is not fighting against gravity for that venous return, to have that blood come back to the heart. Okay, they're also not fighting, it's also not fighting against gravity to pump that blood out. Okay, and your heart rate is lower, so your body is working a little bit more efficient. Okay, any questions on any of that thus far? Okay, all right, like I talked about, it lowers your heart rate. Okay, we did this slide already. Let's move forward. Okay, so if you move from the supine to the standing position, so if I'm laying flat and I stand up right away, okay, it reduces venous return, okay, because it's due to gravity, and this will cause a drop in your blood pressure. Does anybody know what we have in our veins that causes the blood to return to the heart? Do you guys remember what the veins have in them? No. All right, so obviously your arteries are elastic, so are your veins, but your arteries, the blood is being pumped out by the heart, okay? So it's not really, so it's easy to fight against gravity, okay? Venous return, when you're fighting against gravity, your veins actually have little flaps that close to push the blood along to go back to the heart, okay? So make sure you guys remember this. So when you go from from supine to standing, it reduces the venous return, and the blood rush, it can a lot of times rush from your brain and cause you guys to pass out, okay? So this is a lot of times when you guys stand up, you might feel a little bit dizzy. That is the blood rushing from your brain to your appendages because of this venous return, okay? Talked about that. In severe cases, like I said, it can obviously cause fainting. This is called vasovagal syncope, okay? And this is common with people with low blood pressure. So if you don't have that blood pressure to pump that blood out and allow that left ventricle to fill back with blood, this is what's gonna happen a lot of times, the venous pooling and also fainting, okay? Questions on any of this thus far? Okay, go past that. Okay, so still talking about going from supine to standing. If you guys ever have thought about it, when you're laying down and you stand up, you should be able to hear or feel your heart beat harder and faster. Okay, so a lot of times in the morning, say you're laying down, let's pretend your resting heart rate is at 55. That initial stand up will spike your heart rate by a good 20 to 30 beats, okay? Because it's trying to pump that blood out to the rest of the body, okay? So your heart is going to beat harder and faster, okay? So blood pressure is obviously lower in initial standing when I come up, okay? And then your heart's gonna beat faster. As I stand for a good amount of time, okay, I'm going to have a little bit of a higher heart rate, but it's going to level off, okay? So initially, all that blood is staying, and then as I stand up, my heart's got to beat really, really fast, okay? My blood pressure is low. It's trying to compensate for that. Then after I stand for a while, it's going to level out, okay? We are going to do all sorts of blood pressure readings in different positions, so you guys will be able to do your lab and notice how your blood pressure actually changes, okay? Stress and blood pressure, so have you guys ever heard of, so like if you go to the doctor, it's called white coat syndrome, okay? A lot of the times you go to the doctor, you're a little bit nervous about your appointment, whatever it might be, okay? And your body's reaction is stress. With stress, your heart rate goes up, your blood pressure goes up, okay? But this is just a temporary spike in blood pressure that normally happens in a hospital or a clinical setting, okay? So if this does happen wherever you may be, wherever you're getting your blood pressure, but especially in a doctor's office, a lot of the times they'll instruct you to do deep breathing, rest for a few minutes, make sure your body is relaxed, okay? And a lot of the times they're gonna have you sit down, okay, with your feet firmly on the ground, not hanging off of a chair. Your arms can't be crossed, your legs can't be crossed. You're in a steady body position to get that heart rate back down, to bring that stress level down so an actual accurate blood pressure reading can be taken, okay? All right, any questions before we get into blood pressure response to exercise? Did I confuse anybody at all? Okay, all right, moving forward, if you have questions at any time, just stop, okay? All right, blood pressure responses to exercise. Okay, so transition from rest to exercise, the systolic blood pressure is going to rise rapidly, then level off once you hit a steady state. Okay, if you guys can remember in personal training classes, your ex-phys classes, whatever it may be, remember you have, initially when you start to exercise, one of the responses is your heart rate is drastically going to go up. But eventually you hit that steady state of cardio or whatever you might be doing and it starts to level off. The same thing is going to happen with your blood pressure. Your blood pressure is going to rise and then it's going to level off after a little bit. So we have that initial rise, then it levels off, okay? So typical systolic blood pressure during submaximal exercise, okay, so you're not at that max, so let's think anywhere from 60 to 80%, okay, so that would be submax, ranges anywhere from 140 to 160, so that would be pretty normal, okay? So remember, it's gonna have that spike, and then it's just going to level off and stay at that place, okay? During maximal exercise, it increases steadily, okay? So if you are doing max exercise, so let's think 85 to 95% of your 1 rep max, okay? Your blood pressure is going to spike, okay, but it's just gonna go up steadily and then it's gonna stay there and it can reach anywhere, it can reach as high as 250. You guys might think that's super, super high, but when you have to think about in maximal exercise, it goes up. After the exercise, it decreases, okay? But this is why a lot of times individuals that have high blood pressure, okay, and they're worried about that systolic blood pressure, they might be told that they can't do resistance training exercises at a max intensity because it's really going to increase their systolic blood pressure, excuse me, even more than it has so already. Questions on any of that? Okay. So typically systolic blood pressure, excuse me, I can't talk today, rises due to increased contraction of the ventricles to raise that cardiac output, okay? So your systolic blood pressure is going up because the contraction is increasing, okay? So the contraction in your left ventricle, so that we're specifically talking about that, is going to be much harder, okay, than it is just if it's typically beating and you're just sitting there, okay? So this raises your cardiac output. Who can tell me what cardiac output is? We just talked about this like 10 minutes ago. Anybody? Just checking that you guys are awake today.
Wasn't it beats per minute multiplied by, what was it, something volume?
Stroke volume. So what was your stroke volume?
Stroke volume is how much your heart pumps, how much blood it pumps in one beat.
One beat, yep. So it's gonna take that times the amount, times your heart rate, which just means it's the amount of blood pumped in 1 minute, okay? All right, you guys are gonna need to know this, so make sure you're trying to pay attention here. Okay, so obviously typical systolic blood pressure, we've talked about this, this should be self-explanatory, results in increased delivery to working muscles, okay? So we talked about if I am working out, and you guys should know this by now, I'm working out, blood is being pumped, being pumped away from my organs, okay? Going out to my appendages, out to the actual working muscles of my body. Okay, those are the working tissue in my body that needs that blood, the nutrients, the oxygen to sustain those contractions. Okay, so that's what happens with systolic blood pressure. It's going out to the working muscles of the body. Okay, diastolic blood pressure. Okay, so there may be no change, or there might be a slight decrease by 10 to 20. If that goes down, okay, remember we talked about that this number is, the decrease is going to be a lot less. Okay, so this is decreasing, the other one is increasing. Okay, and we need to make sure we look at this, because if it is decreasing, that means our left ventricle is not able to actually fill up with the adequate amount of blood. If it doesn't fill up with that adequate amount of blood, then there is not enough blood flow to be pumped out with that left ventricular contraction. Okay, so this is why this is really important to look at this number. Most of the time you won't see a change, but you could see a slight decrease. Now, if it goes anywhere below this number, we know you have a problem. Exercise needs to immediately cease. Okay. A lot of times this is due to blood vessel dilation, okay, in large muscle groups. So that means your blood vessels in large muscle groups are going to dilate in order to bring more more blood into the muscle in order to receive those nutrients and oxygen, okay? So our blood vessels are going to dilate, all right? So when our blood vessels dilate, then we don't have as much blood being pumped back into our left ventricle, into our heart, okay? Some more responses following heavy exercise, your systolic blood pressure, so that top number drops rapidly, okay? This is called hypotension. So after you stop heavy exercise, say we're talking about max lifting, so that blood pressure goes up super high, like I said, that's systolic blood pressure, then it goes down rapidly, okay? So that's called hypotension. You guys are gonna know, you're gonna need to remember that term, okay? This is due to pooling of blood in blood vessels that were dilated during heavy exercise. So what we just talked about, obviously those working tissues in our body, those large muscle groups need blood in order to sustain contractions and things of that nature, okay? So once this happens, blood pools in our appendages, okay? So as our blood pressure goes up, blood is pumped out, okay? Then there's not a lot of blood coming back. That number drops drastically and very quickly. Okay, this causes reduced venous return and decreases cardiac output. So I said this a couple slides ago. That means if the blood is being pumped out, we are not having as much blood pumped back into that left ventricle. Okay, if we don't have as much blood there, we're not going to have that cardiac output. We're not going to have as much blood pumped out per minute of our heartbeat. Okay, questions? Have I lost anybody? No. Okay. Continuing with this blood flow after heavy exercise. Okay, so obviously the decreased decreased venous return, there's also going to be a decreased blood flow to your brain. Okay, so obviously it's going out to the working muscles of your body. It's going away from your brain. This is why a cool down is necessary following vigorous exercise. I don't know if you guys have ever done vigorous exercise. I know a lot of you are athletes and hopefully your coach tells you not to sit down, okay? Obviously when you guys are having vigorous exercise, the heart is pumping, blood is going away from your brain. You need to slow down, cool down, so your blood pressure can drop steadily and not rapidly. When we get that super rapid drop is when we have to worry about blood going away from our brain and us possibly passing out. So once you stop exercise, a lot of the times you'll hear individuals say, all right, keep walking around, get your heart rate down. Doing that gradually helps with getting your blood pressure down, decreases the chances of you guys actually fainting, okay? Questions on any of that? Okay, we just talked about that. So pathological blood pressure responses, okay, so these are things that happen over time, okay? Obviously, cardiovascular disease can have a large effect on blood pressure. A lot of the times, cardiovascular disease is going to increase your blood pressure, so you're gonna have hypertension, okay? So if we talk about those arterial walls, if they start to harden or they have plaque buildup, then we know that the blood is going, or the heart is going to have to pump harder in order to get that blood flow to the rest of the body, increasing our blood pressure, okay? So obviously there's a lack of increase in systolic blood pressure and severe increase or decrease in diastolic blood pressure, okay? So we having a hard time pumping it out, okay? We can't pump as hard, okay? So that systolic blood pressure drops a little bit, and then there is an increase or increase or decrease in diastolic blood pressure, depending on how much blood actually gets back to the heart. Any confusion on any of this? Okay. Other things that are cardiovascular disease and responses. Okay, so it can lead to syncope, pallor, or poor perfusion. So syncope is basically looking pale. Okay, syncope is fainting. Okay, pallor is looking pale in your skin. You're not getting the blood flow. Okay, obviously, and poor perfusion. Perfusion is just blood flow throughout the entire body. So this is what cardiovascular disease can affect, okay? Obviously, you may have a higher chance of actually fainting, syncope, pallor, okay, which is the pale look in your face because you're not getting oxygen and nutrients to your body, and obviously poor perfusion, which is just blood flow throughout the entire body. So obviously oxygen and nutrients are not getting to the working tissues of your body, okay? Indications to stop exercise. So when you guys are actually exercising, if any of these things ever happen and you are taking blood pressure readings for your client or whoever you might be with, if these happen, you have to absolutely stop. So a drop in systolic blood pressure of greater than 10, drop in systolic blood pressure greater than 10 with an increased intensity of exercise. So let me tell you what that means. As you exercise and you're increasing your intensity, your blood pressure should go up. So that systolic number needs to go up. If you are not having that increase of more than 10, then you need to stop. That means your heart is not pumping enough through that ventricle to get out to the rest of your body. Okay. Also, systolic blood pressure falls below resting value in the same position. Okay. So if you're standing there and your systolic blood pressure starts to drop immediately without doing much, okay, indication that you need to stop. All right. Also, if your systolic blood pressure rises above 250, remember we talked about it gets up to 250 with that max exercise. If it goes above this, you should stop. That means the heart is working way too hard, okay? And this could lead to things like heart attack and things of that nature, all right? Your systolic blood pressure, if this rises above 115, okay? So we talked about that regular number down there is between 70 to 80. And we talked about the changes that happen are normally it decreases, possibly increases by 10 to 20. So if we see that increase above 115, okay, then we know that we are not getting enough blood back into the heart, okay? And then exercise needs to immediately stop. All right, make sure you guys review this because this will be on your exam. We will obviously go over it in lab again, but just letting you know now so you guys can bookmark it, okay? Other indications to stop exercise, so make sure you guys bookmark this as well. Heart rate does not increase with intensity. So same thing, if you are increasing your intensity in a workout and your blood pressure doesn't go up, obviously you should stop. If your heart rate doesn't go up, you should stop. That is a natural reaction to increased intensity, okay? To allow for more blood to be pumped out to the body. If your heart rate is not going up, your heart is not working efficiently and you need to stop, okay? Poor signs of perfusion. So if there's no blood flow, so you could think about things like blue fingernails, pale hands, that means there is not good blood flow. And signs of dyspnea, that's also pale, ashy looking skin. So all those are indications that blood is not being pumped out to the body and exercise needs to stop. Okay. All right. So before I go on, any questions on any of that stuff? Okay. All right. So response to isometric exercise. Remember, we should know that isometric exercise is that sustained contraction, okay? Or it could also be considered in this, or what we're going to be talking about here, exercise that is done between like concentric exercises that are done slowly. I'll explain that when we get there. But so isometric exercises are those that we hold for a period of time. So think of holding a plank for 30 seconds to a minute. That can be considered isometric exercise. Slow contraction exercises, so those are your tempo exercises. So if you're doing a concentric exercise for anywhere from 4 to 6 seconds, okay, that can also be somewhat of an isometric exercise, okay? Sustained muscle actions occlude blood flow. That means it basically stops the blood flow and can increase resistance to blood flow. All right, so even though your working muscles need oxygen, okay? When we sustain a contraction, okay, whether it's a tempo exercise or that's the same contraction as a plank exercise, blood flow is actually reduced, okay? And so when blood flow is reduced to that part of the body, okay, it's going to cause extremely high systolic blood pressure and diastolic blood pressure, okay? Your body's response is going to have your heart beat faster to try to get the blood pumped out quicker, okay? So it naturally is going to raise systolic blood pressure and diastolic blood pressure. So even though contracting muscle is happening, it results in an increased blood flow, continuous contraction, and can impede blood flow. So like I talked about, it's trying to increase that blood flow, so it's going to pump faster, okay? It's going to sustain that continuous contraction, and that's what is causing the blood flow to be impeded, okay? This slide right here gets a little bit goofy how it's laid out, so if I have confused you, let me know, and I can talk you guys through it again. But just remember, so it's going to initially impede that blood flow. It's going to cause your heart to pump faster to increase the blood flow, okay, to that working muscle, which is going to increase systolic blood pressure along with diastolic blood pressure, okay? That's what you guys need to remember about that, okay? So just as an example, so isometric contraction of the forearm. So if I'm just holding my forearm like this and contracting, okay? So at only 50% max effort, it can reduce your oxygen delivery rate by 60% after only 20 seconds. Okay, so basically what that means, I'm not even 100% contracting, I'm only at 50%. It reduces the actual blood flow, to my arm by 80%. Okay, so when we are doing these types of exercises, we really have to make sure that we are checking on blood pressure, and we do not have a client that has super, super high blood pressure and we are causing them to do this. I don't know if you guys have ever also looked at someone that's doing a plank or an exercise like that, or doing a tempo exercise. A lot of the time, just naturally, you see them holding their breath. Okay, this also raises your blood pressure. This is also a reason that we should be watching isometric and tempo exercises with clients that have high blood pressure. Okay, in an effort to fix this, obviously, like we talked, your heart and brain are going to work together, and their response is to increase that blood pressure to force blood through. So just what I talked about a few slides ago, obviously we're not getting that blood flow to the working muscles. Your brain, your heart, they work together with receptors. They say, okay, hey, I gotta pump harder, all right? And they're going to pump harder against those arterial walls, increasing blood pressure, all to get blood flow to the heart, okay? All right, I'm gonna stop here because this is what we were gonna go over during our lab, all right? Most of this stuff is information that you have all gone over. However, okay, I know sometimes when I explain things, maybe I don't explain it the way that's easy for you to understand. I will never take offense if you guys say, hey, Coach K, I have no idea what you said, or you confuse me. So make sure you guys are asking me questions, even if it's not on Zoom, over email, whatever it may be, if you guys are confused on this stuff, okay? I have had some questions from individuals that have asked if there is a book link to this class. Okay, I know some of you might not want it. You are not required to have it, but if you would like it, let me know. I will give you the link, okay? It might help to sometimes look at stuff. Most of your information is on your slides. You don't need much more, but I know everybody learns differently. So if you guys need to have the link, just make sure you guys ask me, okay? A lot of it is not used in the class, but I can point out the areas of what you guys need. Okay, does anybody have any questions about this lecture or anything moving towards Wednesday? You guys are so quiet, but that's fine. Okay, if you guys are done, you guys can all sign off, okay? But just make sure if you guys come or if you have any questions, you guys let me know. Oh, before you do sign off, hold on one second. For Wednesday, okay, we are going to be going over circumference measurements, okay? So waist to hip ratio, and then we might also be using the actual calibers to take body fat measurements, okay? So when you come to class, if you have a sweatshirt or a sweater on or whatever it may be, make sure you have a t-shirt underneath. I'm not gonna require you guys to take your shirt off or anything crazy like that, but the smaller the material, the easier it is going to be to take those measurements and the more accurate it's going to be. When we do get into lab, if anybody is uncomfortable being close to somebody or just uncomfortable in general with body fat measurements, just let me know. We will work around it with you guys. This isn't something that we can't actually all just sit and watch together, so we can work through this together. But I don't want anybody to feel uncomfortable because of COVID or any other reason. So just know that you guys can come to me and let me know if you guys are confused. Make sure you are on time on Wednesday, okay, so we can get things covered. I can answer any questions and I can get you guys out of there by 1:30 because I know you don't want to stick around any longer than that, okay? All right, that's all I have for you to get today. You guys are good to go and I will see you on Wednesday. Let me know if you have any questions. Have a good day, guys.
Have a good day.
Bye.
Bye.
Are you able to meet after class on Wednesday?
I